Come in.
Hi there.
Hello.
I'm Molly. I'm going to be your nurse today.
I'm Chris.
So you're here to get a head-to-toe assessment. Is that correct?
Mm-hmm.
Okay, great. So I'm going to be performing that in a little bit. But first, I'm just going to ask you a few questions. So I hear that you're in law school, right?
Yep.
Okay, and how's that going?
It's good. Stressful.
Stressful?
Yeah.
Do you do anything to relieve your stress?
Just try and relax at night with some friends.
Yeah, that's good. We all need to unwind sometimes. So do you have any questions for me before I begin?
Nope.
Okay, so first of all, I'm going to sanitize my hands. And I'm going to point to 3 objects that I'm going to ask you to repeat later on after the assessment.
Okay.
So this?
Stethoscope. Watch. Pen light.
Perfect. So I'm going to ask you to repeat those at the end of the assessment.
Okay.
So right now I'm just doing your general survey. You don't appear to be in any apparent distress. No acute pain.
No.
You look like a healthy individual.
Mm-hmm.
You're not in any pain, correct?
Nope.
Okay, perfect. Your posture's good, nice and straight. So yeah, everything looks good. So I'm going to go ahead and begin the assessment I'm going to palpate your scalp and do your skin and nails and stuff. Is that okay?
Okay.
So I'm going to go ahead and grab your hand. Checking your capillary refill. Looks good. Your nails look nice and clean. You practice good hygiene. Clean your nails. Good skin turgor. No visible rashes or anything like that. No?
No.
Good. Okay. So I'm going to go ahead and palpate your scalp. I'm looking for any lesions, alopecia. He has good hair texture, nice and thick. No alopecia, no lesions or cysts. Good. Okay, I'm going to go ahead and move to your face, ears, and neck. So I'm going to go ahead and palpate your lymph nodes. Nothing, no enlargement. And I'm going to go ahead and palpate your thyroid, so go ahead and swallow for me. Good. Thyroid feels good. Your ears are symmetrical. Everything looks good. I'm going to go ahead and do a sharp, and I want you to sharp and dull test, and I would like you to tell me whether you feel the sharp side or the dull side of this pencil. Okay?
Okay.
So this is sharp, and that is dull. So go ahead and close your eyes.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Perfect. So good. Okay, I'm going to go ahead and ask you to raise your eyebrows, frown, smile, puff your cheeks out. Okay, and I'm going to go ahead and ask you to clench your teeth while I'm doing this. Okay, good. Good. And then I'm going to push your face this way, and I would like you to try and push it the other way. Okay, now this side. Good, your muscles are working good. So I'm going to move on to your eyes. I'm going to go ahead and ask you to remove your glasses. Do you ever wear contacts or anything, or
Nope.
You always wear your glasses?
Yep.
Okay. So go ahead and look right at my nose. Perfect. Normal. Your eyes are reacting, they're dilating. So your pupils are round, reactive, equal, and reactive to light and accommodation. So that's good. I'm going to go ahead and ask you now to follow this pen light without moving your head, okay? Just with your eyes. Good. Okay, so now I'm going to go ahead and look at your ears. Your external ears look symmetrical, no lesions or anything present. And I'm going to go ahead and do the Weber test now. So I'm going to strike this tuning fork on a surface, and I'm going to put it on your forehead. And then will you tell me if you hear the sound equally in both ears, or one is more louder than the other?
Okay. Equal.
Good. Okay, so now we're going to go ahead and move on to the neck and the chest and lung sounds. So I'm going to go ahead and palpate your carotid artery. A good 2+ pulse. That's normal. 2 is normal. We did your thyroid, and so go ahead and give me a little shrug. Okay. So I'm going to go ahead and do the lung sounds. So every time you feel my stethoscope touch either your chest or your back, go ahead and take a deep breath. and let me know if you feel winded and we can take a break.
Okay.
I'm going to move to your back now. Thank you. Okay, good. Your lung sounds are nice and clear. No wheezing or crackles or anything like that. So you're all good. And so now I'm looking at your chest wall, and it looks like the lateral diameter is larger than the anterior and posterior, so that's normal. No barrel chest or anything along those lines. So I'm going to go ahead and listen to your heart sounds now. So just breathe normally, and I'll go ahead and do that.
Okay.
I'm going to go back and listen to the sounds with the bell now.
Okay.
Okay, you have a nice, strong, healthy heart. And I forgot to mention at the beginning of this assessment, the nursing assistant already took your vital signs, and everything was normal. Your blood pressure is 120/80, respirations of 14, pulse of around 70, and your temperature is 96. And you're not in any pain, so that's good. Do all those vital signs sound normal for you?
Yeah.
Yeah, and you appear to be about 23, is that correct?
Mm-hmm.
Okay, good. So yeah, you look your age, and you're a healthy young male, and your heart sounds good. I'm going to go ahead and ask you to lean forward for me. I'm going to palpate your apical pulse, okay? Okay. Thank you. So we did the heart and the lungs. No abnormal sounds, so that's good. I'm going to go ahead and ask you to go ahead and lay down right here, and we're going to go ahead and do the abdominal assessment. So I'll move this chair out of the way. Thank you. So I'm going to go ahead and first listen to your bowel sounds. I do not want to palpate before because that could give me false readings for the bowel sounds. Okay, so good. You have good bowel sounds. Could be easily heard in all four quadrants. Now I'm going to go ahead and percuss your abdomen and listen for any abnormal sounds. Okay, so good. All normal sounds. I'm going to go ahead and do light palpation. Please let me know if you feel any pain or discomfort during the assessment, okay? Okay, now I'm going to go ahead and do deeper palpation. So again, let me know if you feel any pain or discomfort. Okay, and while you're lying down, I'm going to go ahead and palpate or percuss the lung sounds. Okay, so all normal sounds. And I'm going to go ahead and have you twist around so I can do your peripheral vascular system. Go ahead and stay. Yeah, okay, here we go. Okay, so I'm going to go ahead and look. No varicose veins. His extremities look like a healthy pigmentation. His feet are a little cold. And I'm going to go ahead and palpate your pulses. Good pulse. Okay, on this side. Okay, I'm going to go ahead and do your popliteal pulse. And on this side. Okay, good. All strong pulses. So now I'm going to go ahead and have you come back to the chair and sit down. Go ahead and sit down. And I'm going to do your musculoskeletal system. So if you could go ahead and just grip my fingers as hard as you can. Good grip strength. So that's good. And I'm going to go ahead and do your reflexes now. So actually, I'm going to have you sit right here so your feet are dangling a little bit more. And I'm going to use this for your reflexes. So go ahead and just relax. Good. Good. Okay, now go ahead and relax your arm. All right, so your reflexes, you're very hyper-reflexive over there, a little not so much on your arms. So that's good. Now I'm going to go ahead and have you stand up. And I want you to stick your hands out like this. Close your eyes. Just go ahead and stand there. Now flip your hands over. Now do that one flipped over. All right, good. No pronator drift. So that's good. And I'm going to go ahead and observe you walking right now. So if you could go ahead and just walk forward. And come back. Now go ahead and walk on your heels. Good. And back on your toes. Good. Everything seems to appear symmetrical, and that's good. And I don't see any edema in your extremities. No periorbital edema, so that's good. Go ahead and take a seat. Did your reflexes. And so now I'm going to go ahead and ask you to repeat those 3 items that I had you name off at the beginning of the assessment.
Stethoscope, a watch, and pen light.
Good job. All right, so that concludes our assessment. Thank you for your time,
Thank you.
and I hope you have a good rest of your day.
You too.